Jaundice is nothing but yellowish discoloration of the baby's body and the sclera. It is very common in the newborn period. Approximately 80% of the newborn babies, they do have jaundice. But not all 80% of the babies will require treatment. Out of these 80%, approximately 4 to 5% of the babies, they do really need treatment for jaundice. So there are multiple causes of jaundice in the newborn baby period. Most common is blood group incompatibility of the mother with the baby. If the mother's blood group is O or she is Rh negative, then there is higher chances of baby having jaundice. Then there are certain other causes that can contribute to jaundice levels, such as septicemia or other infections in the newborn period that can contribute to the jaundice. So feeding is very important, especially in the early days of life. The more the mother will be feeding the baby, there will be lesser chances of the jaundice level going high. Also, it helps in decreasing down the bilirubin level in the babies. As I told earlier, that most of the babies will not require any sort of treatment, but if the bilirubin level, that is a jaundice level, if it goes above a certain level, then we need to admit the baby in our NICU, and we start with specialized phototherapy lights where a certain wavelength of lights get emitted from those devices that help in decreasing down the jaundice level. This is the most common and the most effective way of treating the jaundice in the newborn babies. So mostly in the newborn baby period, the jaundice usually starts presenting at around day 2 or day 3 of life. It goes at its peak at around day 6 and day 7, and by the end of 2 weeks in term babies, the jaundice level comes back to normal. In few cases, it can get prolonged, for which we need to see the baby and try to diagnose what the issues are with the baby that the jaundice is getting prolonged. So if we diagnose the jaundice early and we start intervening, that is, we start with the treatment, then the jaundice level can be controlled. There are cases where the jaundice level has gone beyond a certain limit. That high level of bilirubin can cause permanent damage to the brain and can also cause a permanent damage in the hearing ability of the baby. It can also cause seizures-like activity if the jaundice level goes above a certain level. Otherwise, in most of the cases, the jaundice has no long-term side effects in the newborn baby.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.